One Part D plan is not inherently better than another Part D plan without taking into account your medications. Each plan has its own plan formulary that will support your medications in a different way. It's important to compare your medications against every plan formulary available in your area to identify the best Part D plan that will help you minimize your costs when taking into account the plan premium and your medications combined. My name is Adam Lubino. I'm a Medicare specialist and a partner in our family business. The purpose of this video is to help you identify the best Part D plan that will enable you to minimize your costs when taking into account your medications and the plan premium. I hope you enjoy.
Okay, so we're going to get started with identifying the best drug plan. We'll enter some medications and understand what the implications of adding various medications will have toward identifying the best drug plan. Even if you are not taking any medications, you still need to choose a drug plan to avoid penalties. Let's start with that. So I'm on the medicare.gov homepage. I'm going to go to Find Plans Now, enter my zip code. Now, the medicare.gov page will help with identifying Advantage plans, drug plans, and Medigap policies. The Advantage plan and the Medigap policy portion is less accurate than the Part D portion. I think it's okay and can give you a decent baseline for things, but when you are really looking to understand Advantage plans and Medigap policies and what's the best fit for you, it really is best to speak with an agent, because these portions of the website are not completely accurate and up to date when taking into account each carrier and the various discounts that the carriers have to offer. There's not a fee for an agent to help you with that. So here, when we go, we're going to select Part D. That's what we're looking for now. Find plans. Now, here's where we would select if we're on Medicaid or different programs for financial assistance. I'm going to select I don't get help from these programs. The tool is now asking if we would like to add our medications when comparing plans. If we're taking medications, the answer to this question is always yes. That's the entire purpose of this exercise. If we're not taking medications, we will select no, and I'll run through that scenario first to show you how that looks. So the plans come up in order of lowest price premium to highest price premium. That's the case because there's no medications involved, so there's nothing else to rank these plans by. We can see that we have 12 total plans available in our area. The first plan has a $0 premium, second plan has a $0 premium, and after that the plan premiums start to increase from there. We can see, I'll go to the second page and show you the most expensive premium in this area is $133.30. There's no way of knowing what the best plan would be for an unknown medication. So there's nothing wrong in choosing a $0 plan. You shouldn't feel like you're compromising and the coverage is not good. The only way to understand how a plan will cover certain medications is to understand what the certain medications will be. So don't feel like you're compromising with a $0 plan. There's many medications that align better with a $0 plan than a plan that's more expensive. So there's no way, it's impossible to plan for the unknown. There are star ratings associated with these plans. All of the plans, you could see this WellCare Value Script plan has 3.5 stars and the Cigna plan has 2.5 stars. If you'd like to have that influence your decision between these two $0 plans, that's fine. I just like to set an expectation that the customer service across all of these plans is probably not going to meet your expectations and can be frustrating at times. So let's go back and begin to add some medications so we can understand how the medications align with different formularies. Going to go back. Start to add some medications. Typically enter the quantity per month, and when you submit your prescription, you have your doctor submit your prescription, he can submit it for a 90-day supply if you'd like. Let's take a look and see about these 3 medications. We're going to choose our pharmacies. Now, we are not electing or enrolling or anything with these pharmacies. This tool is just helping us understand how much the medications will cost throughout these different pharmacies that we select. Always check mail order, always check CVS and Walgreens, and then choose some others. So again, the WellCare value script happens to be the least expensive plan, but now the plans are ranked based on the total drug and premium cost. So for the remainder of the year, I'm doing this analysis in August. This is going to take into account September, October, November, and December. For the remainder of the year, our medications will cost $10.60 when including the plan premium and the medications. And I'll drill into that so we can get a better understanding. But just to give you confidence again in regard to what I was sharing about, medications need to align with the formularies, and a $0 plan is not necessarily a bad plan. Let's look at how these medications would be covered on a more expensive plan. So $10.60 with this $0 plan is what your medications will cost for the remainder of the year. And again, now these are ranked. They're getting more and more expensive when taking into account the total cost, premium and medications. I'm going to go to the most expensive plan, $133 a month. Let's look at the plan details. And the medications will cost $16. So here you could spend $133 per month on the plan, and the medications will cost $6. These particular medications will cost $6 more than the $0 plan. So now the reason this is ranked as the lowest is because the total cost with the plan premium and the medications is $549. Going to go back now and we'll look at the plan details of the WellCare value script. $0 premium, $10.60 through pharmacy. If you were to order the medications through mail order, you could see they'd be more expensive. As we scroll down, it's important to identify and understand what pharmacies are preferred. You don't want to go to an out-of-network pharmacy, and you don't want to go to an in-network pharmacy only. You want to go a preferred pharmacy. So here your medications with this out-of-network pharmacy would be over $1,000, where you can see at Walgreens the medications would be $10.60. We scroll all the way down to view more drug coverage, and we could see that the atorvastatin, lisinopril, and tramadol are all Tier 1 and Tier 2 medications. The plan has a $590 deductible, but the plan helps with Tier 1 and Tier 2 medications prior to the deductible. So here's the tiers. Tier 1, $0 copay. Tier 2, $5 copay. And if we look at Walgreens, we can see what the medications will cost. $2.65 for the tramadol, and the other medications will be $0. Scroll up. We could see that for the remainder of the year, the medications will be $10.60 at Walgreens. Going to go back and add some more medications now. See how that changes our results. If you enter a brand name drug, the system will suggest that you modify the medication to a generic. In most cases, the generic will be significantly less expensive than the brand name. In some instances, if it's a new generic, it can be more expensive than the brand. So if you're okay with the generic, I always suggest adding the generic, and when you look at the plan details, if something looks out of the ordinary, like the medication looks expensive, you may want to go back and add the brand. For now, we'll keep the brand and we'll compare it to the generic. Compare plans again. Again, WellCare Value Script, the lowest price total plan, taking into account medications and premium. Let's look at the plan details. And now we could see that this Synthroid is tier 4, where the generic for Synthroid is tier 1. Let's look at Walgreens again, with it being a preferred pharmacy. And we could see that the Synthroid cost $50 to fill prior to the deductible being met and $20 to fill after the deductible being met. So we are not going to hit our deductible with the remainder of months left in this calendar year. And let's look at that. So at Walgreens, it has us spending about $53 each month. And we could see that the other preferred pharmacies, Safeway and CVS, are very similar as well. Avoid the out-of-network pharmacy. Scroll up a little bit. And we could see the total annual cost across these pharmacies as well. Very similar between Safeway, CVS, and Walgreens. This is just for the medications for the remainder of the year. And below, we have the medications and the premium for the remainder of the year. In this scenario, these numbers are identical because it's a $0 premium. Go back and add another medication. Remove Synthroid. Keep the same pharmacies. And now the tool is recommending a different plan. So because of the Eliquis, we are aligning better to a different formulary, that being the AARP United Healthcare formulary. This plan has an $82 monthly premium, and in total for the remainder of the year, we would spend $616 at the pharmacy for the drug costs and premium costs. Let's take a look at the plan details now that we've added the Eliquis. Let's see how it's ranking each medication, how they fall into tiers. We can see the Eliquis is tier 3, and the others are tier 1 and tier 2. Here you can see CVS is in network, where Walgreens is preferred, and you can see the impact to the medications there. So ideally, you would choose Walgreens over CVS in this scenario. This is the total annual cost for your medications. And these numbers here are your total annual cost for your medications and the drug premium for the remaining 4 months of the year. So really, that's all there is to it. It's all about adding your medications in the tool so you can understand which formulary best aligns to your medications to minimize your costs. And I hope that this example gives you a better understanding of how you could never choose a plan without knowing what your medications are. Identifying the proper Part D plan needs to be done every calendar year between October and December for the following year. It's incredible how many people are not aware of this and how many people are on the street with a drug card that does not minimize their costs. They could be spending way more than they need to because they are not performing this evaluation each year. I hope you found this helpful.